I don't think I can fully put into words the impact that it had for me, to be honest. I think it's such a competitive space trying to get postdoctoral fellowship funding. And it's provided me with an opportunity to, there's those really tangible metrics that are important for some things, like increasing, the number of publications and funding awarded and the number of PhD students I can supervise and things like that. But it's sort of more than that. It actually provides a level of confidence and a validation of the importance of the work that we're doing together. So it's really about just supporting me as an individual and helping me achieve some of those goals from a career perspective. But really what we're doing it for is for the women and families who are having babies in the country. So it's just really nice to be supported in those endeavours.
I guess what we're really seeing at the moment is that the funding environment for researchers, particularly researchers in mental health, is really, really tough. It's really difficult to get grants. It's becoming more and more competitive. And, what we also know is that the size of the problem in terms of mental health, I've just been talking about how things are, getting a bit worse with COVID, particularly for young people, and yet we're not seeing corresponding investment in mental health research. So Australian Rotary Health performs such an important function by having that support, having that research support. That means that people like me can have an idea, develop a program, and actually move that forward, get it trialled, and as I've talked about, then be able to disseminate it, put it out there in the community for people to use. So it is such an important role that Rotary fills in that respect, yes.
When I was considering doing a PhD, it was on a different topic altogether, but then having contact with the Smithton community and hearing about their concerns and their needs, it really shaped kind of an entirely new program of research. So that's kind of the first, I guess, impact, is that being on the ground and speaking to Rotarians who are really leaders in their community and are quite aware of what's going on has really helped me find kind of an area where I can make a difference through my research. And I guess the other really beneficial part of being involved with Australian Rotary Health has been literally connected to individuals who are on the ground and wanting to take up evidence and transform that into practice and change in the community. It's one of the most rewarding things that I can come across as a researcher, is to be able to provide evidence to individuals who are then out there and using that to make a difference, and it's been a really rewarding experience.